I'm never seeing anybody anymore. So.
Right. They'll do, I believe we can begin our meeting of the Regional Advisory Council. Jody will try to join us a little later on. He has a conflicting meeting at the same time. So when it comes time for his report, he's going to see if he can slip away and come on and join our meeting. Welcome to everyone, both our members and our guests. We'll just begin with approval of the agenda. Are there any recommended changes to the agenda? Hearing none, are there any changes recommended for the minutes? Any errors or corrections or additions? Hearing none, may I have a motion to approve the agenda and minutes?
I'll move for that.
And who is speaking?
This is Kimberly Bryant.
Thank you. Is there a second?
I'll second.
I'll second.
And would you say your name?
Jen Nimmo.
Thank you. All in favor, say aye.
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 Opposed? Okay, opposed? Hearing none, the agenda and minutes are approved. Okay, I believe then we are going to then move on to public comments. For public comments, in this format, people have to notify us ahead of time. And so we have Teresa Adello from the rec coordinator for El Paso County. We're going to let her go first because she just has a short announcement for us.
Yeah, hello. Welcome all. My name is Teresa from El Paso County Parks. So I do all special events for all of the parks in El Paso County. I sometimes do county fair. I go south to Fountain. I go north to Palmer Divide and just have a good time planning fun events. So, and I realize that we've never reached out to this group. So I wanted to just let you know about some of the fun events that we have that are more geared towards seasoned adults. So one of the things that we're having is a walking club, El Paso Pacers. And that's just a 2-mile walk. It's more of a talking, walking club versus you know, exercising and really doing high energy and learning about nature. So it'll be fun. And that's going to be on February 11th. We have a virtual wine tasting fundraiser coming up on February 20th. But then we also have other things such as a forest bathing walk and art to die for, where you're learning how to use materials with natural elements and to dye clothing and other things with. We have an afternoon of Native American flute music coming up in Fountain Creek. Nature's Lovers, we have a book club, life lessons from plants in Cattail Marsh, learning about how plants are adjustable and flexible in the weather and how maybe we should learn from that. And we also have birding clubs and a whole bunch of other stuff going on. So I am free to leave my contact information, but it's all mostly found on elpasoco.com, which is the El Paso County website. Then you could look up special events or look up, ooh, I was interested in that walking club, or Google for what you're looking at. And also, if there's ever any questions, please feel free to use me as a resource to reach out about what's going on with the parks and anything that we have going on. Because we also, this year, we're turning 50 to celebrate our 50 years. Now, since we started, we have over 8,000 acres and over, you know, so many miles of trails and 2 award-winning nature centers So if anyone ever has questions about that or whatever, feel free to contact me.
Phone number?
My phone number is 719-520-6977. You know what I'll do is I'll type my phone number and my email in the contacts. Oh, wait, there it is. Oh, you were on it, Jessica. And I'll type my email in the contacts too. So you could also research that. And if you have any other questions, you could just follow up with that.
Wonderful. Thank you so much. I just have one question. Do most of these walks, where do they originate? Or
Some of them, like such as the El Paso County Pacers, is out of Bear Creek Nature Center, so sort of centralized in El Paso County. A couple of them are out in Fountain Creek Nature Center is where they're based on. But the 50K for 50 years, since we're turning 50, we have different walks all throughout the county, from Palmer Divide to Paint Mines way out east to Jones Park out west, and just dabbing into everywhere.
wonderful.
I have a question. It's Marilyn. Just wondering, are your events on Meetup, the Meetup website, where for people to join in of special interests that, you know, can link into you that way?
Yes, we have a meetup group. It's called Active Adults Meetups for the Bear Creek and Fountain Creek Nature Center. We created that especially because of lots of the stuff we do are, you know, kids, like, oh, let's do a kids event. And it's just, oh, I don't want to read about a 3-year-old event going on. So we have that Active Adults Meetup group. That is, I think you just got to search for Active Adults, like Bear Creek, Fountain Creek Nature Centers.
Great. Thanks.
Mm-hmm.
Thanks a lot, Teresa. Sure appreciate you sharing that information with our group. This group is pretty good about getting the information out to others in the community. So thank you so much.
Thank you.
Fantastic stuff.
Okay, Jason from Silver Key has some information to share with us today. Jason?
Good morning, everybody. Can you hear me, B?
Yes.
Okay, great. If I may, I'm going to share my screen so I can present this information to the group. Oops. Are you able to see the PowerPoint? It's not showing up on my screen.
I have it.
Yes, it is.
Yeah, I can see it.
Can you put it in
Okay.
slideshow or?
Yes.
There we go.
Is that helpful?
Yes.
Yes.
Okay, great. Well, thank you all for taking a minute or several minutes for me to talk. For those of you who don't know, I tend to talk a lot, but I'll try to be brief in this presentation. This is kind of a build from a conversation that I had with the RAC about 1.5 years ago. And for those of you who recall, one of the challenges that I was experiencing as I was over here at Silver Key is I learned something that was very troubling about the way the system functions for individuals who qualify for Medicaid and already have Medicare. So it's generally those that are age 65 and older. And I'll tell you why that's a little bit of a challenge here in a minute. But that's, for those of you who remember, I was saying that there are some people who qualify for Medicaid and what's called a behavioral health benefit or mental health services. And for whatever reason at 65, they lose those benefits in the full suite of what was available to them prior to being 65. So with that, I had been working with several partners to be able to figure out how can we be able to improve the system at the state level and at our local level to be able to make sure that individuals who have meet the criteria to qualify for Medicaid behavioral health actually get that benefit. And so after many different conversations throughout the state and through our local county, the county is the one who processes those applications. I've learned a lot about this process. And from that, I have engaged the partners of NAMI, National Alliance on Mental Illness, Colorado Springs office, the City of Colorado Springs Fire Department, and Innovations in Aging. Several of those folks have been funded by PPACG in the past. And so what we did as a collaborative, we brought together this model called the Comprehensive Senior Assistance Program. And we presented this to Next 50, which is a major funding source for initiatives involving older adults. So let me tell you first a little bit of what the Medicaid disconnect is and why these agencies came together to be able to help address this. On this slide, you're going to see here, it was a small sample that I had taken from Silver Key's services that we provide for those that are age 65. And what I'm going to highlight is at the bottom there, approximately 10% or 2 of them qualified for this full behavioral health benefit that I was describing. Whereas you see many of the others, for a lot of different reasons, didn't qualify. And when I called the state and I said, help me know why these 2 qualified, what's unique about them? When it seems as though the demographic information we had for all of our other population was aligned with them. Unfortunately, the state said something that probably was not the best answer, or that representative. She said, it depends. And the problem when you have a state rep saying it depends, as you know, that could translate into, well, that means maybe the system's broken, because it really needs to be more of an algorithm kind of process. So that's what triggered me to be able to dig down a little bit further into this and say, for those that are over 65, is there a way that we could think differently about how we provide that care to those folks and be able to get it funded by Medicaid? And I'm talking about behavioral health care. So with this, the bullet here at the bottom where it says 65 years old, what I originally put there was a candle, and I was going to say, happy birthday, you're 65. You lose the support of case management. You lose the benefit of substance treatment. You lose the benefit of advocacy that was funded when you were 64 years old or less. It's a mind-boggling situation where people have been maybe maintained, supported, and all of a sudden there's no system that's able to bill for that support anymore. So as you can imagine, that puts people in a very difficult place, because potentially they have significant major mental health issues, and then they end up in higher levels of care like skilled nursing facilities, or more often as a solution is inpatient psychiatric care. The problem with inpatient psychiatric care is that sometimes if you can do a community solution that's proactive and preventative, then you've got people that are in that higher level of care simply because their insurance went away. That's not the right model for our community, I don't believe. So again, this partnership came together to work with Next 50 to be able to think about this a little bit differently. To summarize the issue and the need is that there was no complete system of prevention that exists for seniors over 65. The system is patchwork, the funding is challenged, and the support at the highest level of care, inpatient psychiatric emergency room, is generally where people go for that care. If they have Medicaid and Medicare, but they don't have that behavioral health benefit off of Medicaid, then they end up in the emergency rooms. Imagine for a minute if we were able to step back and be involved with that person's life. Once they're 64, they turn 65, 75, 85, where we have this model that's supportive until somebody truly needs the benefit of an emergency room or an inpatient level of care, but not before that. And that fits squarely in the mission of Silver Key, and certainly with our partners that are moving this initiative forward. I believe our system has the capacity to be integrated in aligned care so that people get the right level of care at the right time in the right place. But it has to be a way to be able to fund it and sustain that. That's what this model was intended to do. Prevention, early intervention works to save taxpayers money. This is the part that I really want for a community advisory committee and for the RAC itself, where we have community members. This part should be highlighted and like shining in neon. Taxpayers are paying for that higher level of care when it's not needed. So this is where I'm rooting the whole model of being able to tell the story a little bit differently, and we've got the funding from Next 50 to do so, and I'll tell you what that means. So first, we took the core competencies of our partners, the first one being NAMI. And for those of you who are not aware, NAMI has a core competence around mental health first aid training for community members. This is really to be an early identification and an education program so that the community recognizes signs and symptoms of a person in need and knows how to access a support, not necessarily waiting, or maybe a neighbor is having a struggle and an ongoing struggle, and all of a sudden you get to the point of where they're going to the emergency room. So it builds a community of understanding that mental health is an important piece, substance is an important piece, and specifically in the older adult population. So with that, this framework addresses the unique mental health challenges of people age 50 and older. It teaches people how to notice and respond mental illness or addiction. This may or may not be a surprise to this group because, of course, all of you have been steeped in this work for a long time, but about 15% of adults age 60 and over have a mental disorder. That's not only treatable, can be supported. But again, that mental disorder not supported can translate into major crisis where we could have been on the front end of that. And even more, I think, stark for a lot of people is that 1 million people age 65 or older have a substance misuse disorder. And that was information that came in 2014. But the other piece is that I think that substance misuse and substance use disorders are flying under the radar for older adults. I will let you know that right now through COVID, with some of the isolation and loneliness that's been out there, we're hearing more and more about the level of dependence on alcohol to be able to cope by seniors. And the thing is that I think that when we have isolation and loneliness, people cope in a lot of different ways. And it may be foreign that somebody would think, well, this person has never had a drinking problem in all these years. Why now? It's because the environment has changed. And so we have to be able to think about recognizing those needs so we can support them through the system a little bit differently. So the mental health first aid training is at virtually no cost. What that means is Next 50 is helping to support us to be able to have this available. You're going to see that we have at the NAMI website, this is available, and the intent is to schedule trainings for up to 20 people in all different kind of facets of the community. So for our partners here on the RAC that are responsible for organizations that serve seniors, great, let's get your staff in this training. For community members that say, I don't know if this is for me or I don't need it, the fact is that oftentimes people who attend the mental health first aid training identify needs within their own self that they didn't recognize because they may have never gone through treatment before, never seen a case manager, never seen a therapist before. And all of a sudden, when you go through this training, I've been living with this anxiety the whole time, and I just lived with the anxiety. This oftentimes triggers a reflection for yourself to say, I may need some help here. Or more importantly, the community recognizes when another person and our neighbor needs help, and we're able to get that help to them. So Silver Key in this partnership, for those of you know, we have care coordination, we have short-term case management and more traditional case management. So the idea being is that we would bring these services together to be able to help when NAMI and the training, when the community identifies somebody in need, they would make a referral to Silver Key for that level of support. Care coordination is the methodical approach to care that facilitates the community around the individual. So I think I call it sometimes the constellation of support. Imagine you having a constellation of support available to you when it was nothing before. Or worse, you had this available to you, you turn 65 and then it's no longer available. This is about really making sure that we've got this ongoing support system around seniors who need that level of care. And SOS is another program that we have here, Senior Outreach Services. That is the one that allows for us to be able to provide community education, mental health services, and connection to the community resources that are available. So that is what Silver Key is bringing to this effort. Related to traditional case management, we assess needs, we refer for services, and we coordinate, consistent with other case management models. The difference with this effort is that we're weaving through the partnership with NAMI and the partnership with the Colorado Springs Fire Department. In that way, the Colorado Springs Fire Department has what's called an intensive case management model, the CARES model, which again, I think that the AAA has helped to fund some of those initiatives in the past. And so what we're doing is we're working to be able to say, how do we make sure that when an individual has a comprehensive service need, that they're not calling the emergency room or calling the 911, but they're actually calling our system first so we can see how we can assess. Now, of course, we don't want to interrupt if somebody can get the support from that higher level of care, but we want to make sure we're getting ahead of that. So the intensive case management is developed to meet those needs at high risk, and you'll see that the idea is to do an intervention when 911, a frequent user of 911, or somebody who really could have this issue solved before far more, and they say economically and efficiently, inefficient model is able to be tapped into. So the idea is that these partners all come together to do this, what's called wraparound model. where we would have the early prevention identification, we would have the case management, the advocacy, we would have the intensive case management, and then we would have this model available to seniors in need. And it seems so obvious, but the reality is much of the way these systems come together is through different kind of funding mechanisms. Well, the one that we're wasting money on right now as taxpayers is because of the exclusion of having this for people over age 65, they're tapping into the Medicaid and Medicare resource at inpatient and emergency room. We're stepping back from that and saying, wait a minute, if we can save taxpayer dollars on the tail end, imagine if upstream we got ahead of this and be able to demonstrate we can do this differently and more efficiently and effectively. That's where innovations in aging comes in. So innovations in aging will be helping us collect the way that our different systems capture data to be able to demonstrate a story that we will be able to illustrate that an individual that is part of this solution on the front end, based on their historical way that they utilize the system, we will be able to demonstrate that we can actually save taxpayer dollars. And I'm going to go a step further and say, I think we're going to be able to move to the point of being able to influence Medicare different funded projects, funded initiatives, like for instance, when you sign up for Kaiser or United Healthcare, I think we could actually tap into those areas and say, look, we can do this a little bit differently than just the Medicare benefit. We can do it more effectively, efficiently, and the person gets a better care. So that's where we're headed with that report that Innovations in Aging will help us use to be able to change the overall system. So some would say, how can you, this is awfully ambitious, how are we going to get there? And it may be great that you get to your report, but how are you going to sustain this? The way we're going to sustain this is we're going through what's called a collective impact model. And Silver Key is the backbone of this entity this partnership that's coming together. As the backbone agency, we're the one that we're creating these partnerships with the other partners, and through that we're guiding and supporting how we're going to be able to collect that data, how we're going to move individuals through the system, how we're going to be able to provide that support. And with that, as Innovations in Aging gets those reports done through the funding that we have with Next 50, we are going to be able to move this forward to Medicaid, Medicare, Medicare Advantage plans, and private pay, and say, imagine if we got ahead of the game a little bit differently than putting that person in a higher level of care unnecessarily. And the collective model first on the outcomes is to be able to be positively impact on the front end, reduce the use of inpatient and emergency usage in the 60+ age group by 25%, increase the competence of the community related to recognizing signs and symptoms of mental health and substance misuse issues, and build a model that influences the public support system for 65. So it is not a takeaway at 65, it's congratulations, you made it to 65, yahoo, let's make sure you have that support system going forward. That's what this is about, and I'm just so excited about this funding that came forward from Next 50. I'm excited about the partnership, and I think if we have another person who unnecessarily goes to inpatient after a couple years down the road, I need to step back and say, how do I do my job better? Because I want to make sure that we're preventative, proactive, and intentional about supporting people to live with independence and the quality of life that they choose for themselves, not because their funding mechanism doesn't support them well. And with that, I've got the screen up that has the information that you can send questions to info@SilverKey. Our phone number, we're being the backbone agency, we're the one that's leading that, the community response around this, 884-2300. And with that, I think I'm still within time, so I can pause if there's any questions.
Let me start by saying, how do you think the RAC can help?
So the RAC has been very helpful by being ambassadors already and supporting some of the ways that we do things. Like for instance, you did help support the fire department in the past, you helped support Innovations in Aging, and you helped Silver Key. So we all took the bits and pieces and parts that the AAA has helped to fund, and we're using our core competencies. So that's the way. Keep us in mind as you think about reallocating funds in the future. Keep us in mind about being an ambassador to be able to say, when somebody is in need, we know how to get them the support. And lastly, be open to be trained to mental health first aid. Because if you will choose to do that and understand when people have that need, that will help us tell our story more effectively.
Wonderful. Are there other questions?
Well, I'm just wondering when we're going to get this sort of thing out to the western part, at least in the
I knew
southern
you were
part.
going to ask that.
That was my
Every
question.
time I come up with this.
Yes, yes, you do. Well, and the thing is that I guess the way I would share this is that I really do believe that if we can influence the state, that translates to the dollars going through the community. So I think it's an indirect link that we're going to get to, and we're really hopeful that this doesn't change just for Colorado Springs, but we influence across the county and across all of our partners at the state.
Thank you.
Yeah.
Other questions?
Well, I hope I didn't completely overwhelm everybody. And again, I know that's a lot of information to take. And if you're not really steeped into this, certainly can understand that. And please don't hesitate to outreach. I value all of you and appreciate the support that has been given to Silver Key for the many, many years that we've been partnered. Thank you.
Well, thank you for presenting. I know as, someone who answers those phone calls, that whole problem of what happens when you hit 65 and your Medicaid benefits change dramatically is always a terrible hurdle. So this is exciting that you're working on that. Maybe I have one more question before you go. Do you need any legislation, or can this just be done by changing rules and regulations?
So we are right now working with the state, the senior lobby, the Colorado Senior Lobby. One of the things that we've talked about is that we've been asked to not bring legislation forward at this point. And the reason why we were told is because of the transitions that are happening at the government level, that if we can do this through technical training and support in the existing system, because if you move it through a legislative process, it probably will have a financial note attached to it. So they've asked us to kind of see where this goes first. And if this doesn't accomplish, then to move through that legislative process.
Thank you. Thank you very much. Okay, we're going to move on then to our other provider presentation. We have Roma Costanza from the Area Agency on Aging is going to share about SHIP and Medicaid, I believe. Is Roma with us?
Good morning.
Hi, Roma.
Can everybody see my screen?
Yes.
Okay. So good morning. Again, I am Roma Costanza with the Area Agency on Aging. I am the SHIP coordinator, which is stands for State Health Insurance Assistance Program, which is a federally funded program that is designed to educate and advocate for seniors in all things Medicare and Medicaid. Also do short-term case management, and we are also responsible for creating and updating the Colorado Adult Medicaid Programs and Veterans Benefits Booklet, which hopefully everybody is familiar with. So I've been asked to talk this morning a little bit about the SHIP program and Medicaid. And honestly, in the Area Agency on Aging, those two go hand in hand most of the time. The SHIP program, again, is funded through multiple grants that we receive both from the Administration for Community Living, which is funneled through the state, and the Colorado Older Americans Act. And it is, again, a program designed to advocate and educate seniors, families, and caregivers on all things Medicare. The SHIP program through this Area Agency on Aging actually serves a total of 9 counties in Colorado. We serve the AAA region of El Paso, Park, and Teller, and then an additional 6 counties south of here, south and southwest of here. We also house typically the Senior Medicare Patrol, which is a program also funded through the ACL, designed to help people by educating and providing information and assistance with fraud and abuse regarding Medicare and Medicaid. So this is a quick map of our service area to show that the other 6 counties that we serve outside of the AAA region. So what we do as a SHIP program is we provide in-depth one-on-one counseling to beneficiaries, families, and caregivers about Medicare, Medicare benefits, Medicare choices and options. We also help during the annual open enrollment periods for review of coverages, including Medicare Advantage plans and Part D plans. We can help with claims, appeals, and processes. We do educational presentations in all sorts of topics related to Medicare. Medicare 101 is the most common presentation that I do. And I have typically been doing Medicare 101s for people who are becoming eligible for Medicare for the past 10 or 15 years. But we also do low income outreach, and that is to help identify and help people apply for financial assistance programs to help cover the costs, some of the costs of their Medicare related coverages, including the low income subsidy for their Medicare Part D coverage. But we are also under a Mipa contract that helps identify and help people apply for additional financial assistance programs. So the Mipa contract, which is a grant from the Division of Insurance through the State SHIP Office. MIPA stands for Medicare Improvement for Patients and Providers Act. And that program is designed to identify and help people with determining eligibility and applying for programs such as the low income subsidy for Medicare Part D. We also help with applications for a program called Medicare Savings, which helps cover the costs of their Medicare premiums. And then we work with local communities and other community partners and other organizations to try and reach those populations in the more rural areas or the harder to reach populations to try and find those beneficiaries and identify them that might be eligible for those financial assistance programs. In the AAA, all of the SHIP counselors, and we have a total of 5 SHIP counselors and a volunteer, we are all cross-trained to do SHIP counseling and short-term case management. As short-term case management, of course, we help identify resources and assistance programs for people in the community. The AAA here is also a certified application assistance site for helping people specifically with Medicaid applications. So we have been trained and certified. We are HIPAA certified, and we can help people with applications for long-term care Medicaid and other financial programs such as the SNAP Nutritional Assistance Program, old age pension, those kinds of things. And we also help with other financial assistance applications such as LEAP, the PTC rebate, things like that. So all the clients that we see on a daily basis, or not see necessarily these days, but that we have contact with on a daily basis, we are always screening to see if there is eligibility for any of the assistance programs that we are aware of and that we can assist with applying for. Because we are cross-trained as both SHIP counselors and case managers, obviously, when we are in contact with a SHIP beneficiary, a Medicare beneficiary, we are going to screen them for all the financial assistance programs that we might be aware of in all regards, not just Medicare financial assistance or Medicare-related financial assistance. And being part of the AAA that includes these other services, such as the Family Caregiver Support Center, the Ombudsman Program, the Senior Information and Assistance Center that puts out the Yellow Book every year, that really creates a very comprehensive network of information and assistance that we can provide anyone who comes to us with any sort of need or concern. Because typically when someone calls, there's not just one need. We usually identify multiple needs, regardless of what that caller initially contacted us for. So again, as a SHIP program, we provide comprehensive assistance with Medicare. But many times during our conversations with these Medicare beneficiaries, we identify other needs, such as the need to try and find ways to save money on medical costs, or they're struggling with paying the utilities or having enough money to buy food. So the fact that we are able to be cross-trained both with Medicare information and the ability to help them identify other assistance programs to help them with their quality of life and to help them stay in the community more comfortably has been a real benefit to the clients that we are assisting. Again, the SHIP program, which sees probably a larger number of the contacts that we have, is a huge help in identifying those needs and assisting those beneficiaries with those programs and that financial need. Any questions? We do help with Medicaid applications, specifically for long-term care. We can help with Medicaid applications pretty much for any of the programs that are identified. We, as a certified application assistance site, we can assist directly with the application and submit it for the beneficiary. We are also able to help explain the programs for Medicare and Medicaid, how they relate to each other, how they coordinate with each other, what they can and cannot do. And then we're usually able to provide follow-up information and assistance with those applications as well.
Well, thank you, Roma. First of all, I want everybody to know that I've had the pleasure of working with Roma for the last 5, 6, I think it's almost 6 years now. I'm the volunteer, of course, she's the expert. And I want everybody to know that Roma is also, she is the trainer, in the SHIP trainer for the entire state of Colorado. So we've got a great resource here at AAA. Roma, we've had some discussions among various members of the RAC about people talking about preparing for long-term care Medicaid applications. I think you probably can infer what I'm talking about. Could you speak to that a little bit in terms of what the AAA can help with and where maybe you draw the limit, or?
Sure. So certainly for Medicaid programs, that assistance is always going to be based primarily on financial eligibility. And for many people, what they don't tend to realize is that Medicaid has typically always been a program of last resort, and it's designed to be an assistance program of last resort, simply because it is a state-funded program, and it's designed to those people who have exhausted all other resources. So when somebody is applying or thinking about needing to apply for long-term care Medicaid, that typically means they had to have exhausted all other resources available to them. And I'm not sure how to put it, but for the thought process of planning to qualify for long-term care Medicaid, that's really not what the program is designed to do or is designed to be available for. So I know I see a lot of people who provide a service that helps people plan for future Medicaid possible need by helping them determine what and where their resources need to go, so that when the time comes, they may not always have to exhaust those resources completely. And it has always been my feeling that, you know, planning for Medicaid is not really appropriate, because it's incredibly difficult to plan for Medicaid. Medicaid actually has processes in place that are designed to identify people who have perhaps moved resources somewhere else to qualify for Medicaid in the future. And they will look back at somebody's financial situation for, you know, up to 10 years to see if that may have occurred where someone moved some of their resources somewhere else in order to qualify for Medicaid in the future. So that can be a kind of a tricky situation to plan for Medicaid, because you really have to be planning for 10 years or more in the future with what you're going to do with your resources. But that's one of the many misunderstood aspects of applying for Medicaid. That's certainly not the only misunderstood aspect of applying for Medicaid, but it's one of the more common aspects, that people can set up trusts to protect their resources and assets, or that they can give money to family or things like that. And that's really, you've got to be really very, very careful about doing that, because again, 10 years in the future is a long time to plan for. And they will look 10 years into the past to see if anything like that may have occurred.
Are there other questions from other members?
We do provide the assistance for all of the programs through the AAA, whether it's Medicaid application assistance or counseling, whatever. We never charge for our services. All of our services are at no cost.
Are the services provided to the deaf with an interpreter?
Absolutely, if necessary, or if there's a language barrier, we can get an interpreter for that as well.
Is there any charge to the person who needs the interpreter?
Not to my knowledge, no.
Thank you.
If it's something we have to provide, we will pay for it.
I see Jen has a question in the chat. Are you able to help someone who has Medicaid from another state and needs to transfer to Colorado Medicaid?
So Medicaid typically is a state program. So when someone moves from one state to another, they lose the Medicaid in the state they lived in, and they have to reapply for Medicaid in the state that they moved to. And honestly, that's not just state to state. That could be county to county within the same state, where they may have to reapply if they move to a different county in the same state. But absolutely, we're happy to help them apply for Medicaid in our service area, wherever they come from.
Are there other questions? Hearing none. Well, thanks a lot, Roma. I miss coming into the office and seeing you.
It's nice to see your face, Bea.
Great. Hopefully soon, as we start to get our vaccines, right?
Crossing my fingers.
Right, right. Thank you so much, Roma.
Thanks, Bea. Thank you, everyone.
Okay, we're going to move on in our agenda to our membership committee. Marilyn, do you have anything you want to share?
Hi, here I am. No, not really anything to put on the agenda today for membership, other than I am moving into the transition of being the chair and learning, with that as well. I do know that our newest RAC members have received their orientation, thanks to Melissa, and, hopefully feel pretty versed in, what is ahead of them as a member of the RAC. And certainly any questions are always welcome. I also think now that Wendy and Lucy are gone, Lucy was kind of a co-chair to Wendy. And as chair myself, I think that I would reach out also to want to find a co-chair that would serve with me to better support or take up some slack or more, more support with the membership committee. So I open that up to someone that thinks they might want to co-chair with me, and we take on this task together. We're also looking for new members. Anyone who has a person in mind that you think would fit well with our membership to the RAC, adding the wonderful diversity that all of our members have. Namely, again, a member from Falcon would be representation for that from that part of Colorado Springs would be welcome. So anyone at any time that, has a person in mind that you think would serve well on our RAC committee, just please let me know about that. And be thinking, any of you out there, if you would like to, serve with me as a co-chair also, and we can discuss that. Thank you.
Okay, thank you very much. And do you have some contact information, or maybe they have your email when the notice comes out, huh?
Yes, and of course I can, I think Melissa has that, but I
Okay.
can,
Yeah.
definitely as chair would have that information.
Sure. Okay. They can contact Melissa and she can pass it on to you then.
Yes, that would be great. If
Okay.
that's okay with you, Melissa.
All right. Okay. And Jen, do you have some information to share on the SRS committee?
I've recently sent out an email to the entire RAC to invite people to join the SRS subcommittee. It's the Study and Review Subcommittee. So we look at the various programs that are going on in our area and how they align with our strategic plan and the 4-year plans. The group meets on the second Thursday quarterly. So it'll be the month before we report out to the RAC. So those meetings for the SRS would be in February, May, August, and November. And the one upcoming is February 11th at 10 a.m. So if you are interested in joining that group, I'd certainly welcome you to join us, and just respond back to the email that I sent out earlier this week, or get in touch with Melissa, and we will get you on that group invite list for the meeting.
Terrific. Okay, so that's coming up pretty soon. So we need to get that on our calendars, huh?
Yes.
Okay. Very good. Melissa, is Jody able to join us now, or?
Yes, good morning.
Oh, there he
Good morning. Yes, I am.
I didn't see you.
That's all right. As it happens, I'm multitasking a little bit this morning. Good morning, all. I'm Jody Barker, Director of the Area Agency on Aging. And yes, as it happens, our quarterly C4A, that's the Colorado Association of AAAs, meeting is today and tomorrow. And so I'm jumping in and out to make sure that I'm where I need to be. So I have just a few things I want to bring to your attention, things that are in process and things that have been going on. So as you know, we've been seeing in the news a lot around vaccinations and challenges around getting not just vaccines out to our 70 and older population, but how to get them to those sites. And so just want to let you know that AAA staff are involved in those conversations, providing feedback and input. Our transportation providers are also part of those conversations at the local and regional levels. There's just a lot going on, a lot of moving parts, but I want to assure you that we are getting involved. We are getting invited. We are inviting ourselves when it is necessary if the organizations aren't familiar with us. So we are taking an excessively proactive approach to making sure that we're part of the conversation and that we can advocate and be the voice for our seniors in our region. That includes Teller County and Park County as well. And so really proud of the conversations. Melissa Martz, and of course our special programs administrator has been in contact with both those health departments and making sure that connections are being made and that our seniors receive the information that they need, but ultimately we find ways to make sure that the services get to them. So more to come as we know more. CARES Act funding continues to be distributed across the 3-county region. In fact, we just distributed some more, in fact, to all 3 counties based on their needs assessments. We continue to process requests and have those conversations. So if there are any providers, our contractor providers that might be with us today that you haven't put in a request to me, please reach out to me. I want to make sure that we have an opportunity to discuss the opportunity. So please reach out to me. But I think I've been able to contact just about every single provider. A couple of things coming up. We do expect our state fiscal year 21-22 options letter. For those of you who are not familiar with the verbiage, the lingo there, the options letter is simply the annual notice of funds based on our 5-year contract with the state of Colorado, the State Unit on Aging Division of Colorado. And so we do expect our 21-22 funding letter soon. We do expect that may be somewhat flat or even lower than last year because the Homestead Act funding has been removed from senior service provision at the state level. And so we're going into that with an expectation of, like I mentioned, somewhat flat funding. There is an interesting balance at the state and federal level, though, so we'll just have to wait and see. A lot of details yet to come on that. So because the 21-22 options letter is expected just about any day, we'll be releasing our RFP. That's our request for proposals. That'll be released soon out to the public. As you know, we will reach out directly to our contracting providers currently, as well as put out public notifications that those RFPs are going to be made available. We do expect that probably mid-February to go out. There is potential for another round of emergency funding, and we're in wait and see mode, as you might imagine, with the transition of government at the federal level. That does it doesn't necessarily stop the process, but it certainly does slow it down. And in fact, in my other meeting, we're hearing from a Colorado lobbyist out of our Dr. Cog partners. That's the Denver Regional Council of Governments. And he serves as a federal lobbyist. And so we're hearing some, we're getting our government training all updated. So as you might imagine, the transition of government has its own hiccups. And so there was congressional funding signed back in November, December. That's when you might remember that Congress determined a $600. That's the same package where Congress determined a $600 level of funding for individuals, and former President Trump said, no, I want it to be $2,000, and things came to a stalemate there for a little while. And so that package did get passed at the previous level. It did include some emergency funding for senior services. How much is ultimately due to each state and each region is still undetermined. And so as we hear more, we will certainly share. And of course, our goal is to get those funds out to the community through our private providers and projects as quickly as possible. We are in the midst of and front end of our annual client satisfaction survey process. Providers that are here with us on the phone call today have been hearing from Melody Dow, our contract specialist and programs administrator, and what all is required with that. They have done it before. Due to COVID, I've never been through this process. So I'm learning as we go. So we actually have a meeting this afternoon to work out some details, but Melody's been really great to get information out to the providers. As I understand it, this process should go pretty smoothly. The state has moved into the 21st century, and some of it can be done online if seniors have that access. And ultimately, we'll be able to update that information relatively smoothly. Fingers crossed, it looks like a pretty slick system. And so we're looking forward to getting that information and available. And of course, as you know, for those of you who have been on the RAC in previous years, 2020, it did not happen because of COVID. They dropped that requirement of the regions to allow us to focus on service delivery. But that helps us in our annual needs and gaps assessments to make sure that we're meeting the needs of the community and determining where we need to do some follow-up, not just our internal services, but also those services with our providers. So the last little tidbit I had mentioned a meeting or so ago, I believe in probably December, about some FEMA emergency food boxes that were coming into the region. This was a partnership between FEMA and the State Unit on Aging there at CDHS. And we were able to receive 920 FEMA emergency food boxes. We were able to distribute those across all 3 counties. A big thank you to the county commissioners in Park County, the county commissioners and emergency services department in Teller counties for providing trucks, trailers, and drivers to come and get theirs. Part of the agreement to receive these FEMA boxes that they would only deliver to one address, and which allowed us to receive those at no cost to our AAA, no cost to the providers, and ultimately no cost to our seniors. And so we were able to distribute, and that was more than 14 regional partners across the 3-county area, all the way out to Rush and Calhan, and all the way west to Fairplay and Bailey. So thank you very much for all the providers that are here with us in the meeting today who helped and may still be helping to distribute those boxes. We have gotten a hint that we may be able to access more late in February. And so if you are familiar or aware of an underserved population or an underserved population served by an organization, because we do want these to go out to organizations who are serving these populations, please pop that in an email to either myself or Melissa Martz, and we will coordinate with those folks and see how we might be able to serve them in this way. The beauty of this emergency food box is that FEMA and the state unit have agreed that we don't have to take any kind of information aside from knowing that those folks are over the age of 60. So I just saw a chat pop up here. That box is a 30-day shelf-stable mix of food for one person. And so if there are 2 seniors in the household, caregiver and a family member, or a spouse, partners, whatever that might look like, that could be 2 boxes. So we are limited by what we're able to get delivered here. And of course, this is a statewide project. So whatever they will give us, I'm sure we can get out to the community. So until we know more, I've asked some other leading questions like, so how many can you fit on a truck? And frankly, we'll figure it out from here. So anyway, so there are a lot of details yet to figure out, but it's exciting to be able to move swiftly and serve our community with this kind of project that doesn't require a lot of data gathering or extra steps, and just getting those needs met. So like I said, if you are aware of an organization serving underserved population, and of course those folks have to be over the age of 60, then please let me or Melissa know. We will make some contacts. We'll determine how we can best meet those needs. And some of those may be just referring them to one of our other agencies that have the capacity to receive them. Because I have, we had a situation in our December delivery where someone was interested. They serve seniors, but they could not receive the delivery. And so we made the connections with one of our other providers. And so it all worked out. They've been able to be part of that distribution network, but we'll make those connections and figure that out. So the other things I want to, the last thing I want to share with you is our Medicare and Social Security 101 classes continue strong. The Zoom has been an interesting system and platform to be able to distribute those classes. I expect Gretchen and Roma may have shared that in their presentations today, but I do want to remind you that's something that we're doing that anyone can access through the year. And we also have a retirement series. Some of you have heard about the INT retirement series. Our team has been asked to expand that statewide. So that's a big, huge kudos to our team with the collaboration there that we're seeing. And that's something that I'm working on from my standpoint with my fellow AAA directors to be part of the distribution and promotion of those programs. So we're very hopeful in 2021 that the good work that's being done, not just in our region, but it ultimately spreads statewide through these partnerships. So it's been an absolute pleasure, and I so enjoy working with our staff and you all as board members. And at this time, I will hand it off to B, Chair, and unless there are any questions for me. I'll take a peek in the chat too, see if I missed anything else.
Are there any questions for Jody? Hearing none. Thanks a lot, Jody.
You are very welcome. I'm going to duck back out and listen to this other information. This is another way that I can grow and learn and bring this information to our region. So thank you very much. And I appreciate your patience as I duck back out. Be sure to take a look in the chat if you have access to that. There's a lot of good information in that that's being shared back and forth. So thank you to our, I see a couple of folks here. I want to give a shout out to Debbie Swanson. She's the new executive director for the Senior Resource Council. And we sure look forward. Oh, there she is. She just popped up. We sure look forward to collaborating with her and the Senior Resource Council. It's always been a really great partnership, and we just continue to look forward to doing even more in the coming years. So thanks everyone, and have a great day.
Okay, thank you, Jody. Well, just a few little bits of information from myself as chair. As you can imagine, there have been lots of questions about the COVID vaccine, and as Jody mentioned, the AAA, of course, is working with the various organizations to get that information out. When I was volunteering at AAA about 2.5 weeks ago, the phone was ringing off the hook asking about where to get the vaccine. Now, when I was there on Monday, pretty much people knew where to go. So that was great. One of the interesting things that we would have known at AAA was the fact that there are a lot of seniors over 70 that were going to have problems with the online signups. Because either they don't have access to a computer and the internet, or they're not really adept with that technology. So I was very happy to see that within the last week or so, phone lines have been set up and making it a little easier to gain access. The one thing I see among the many seniors that I interact with on Zoom in the past month is that with 65,000 seniors over the age of 70 in El Paso County, for example, we're not all going to get it at the same time. In fact, we will have to wait in line, and that's a little frustrating for people, but they'll definitely get it soon. The second topic, over the holidays, a senior came to the attention of Melissa related to adopt a senior. And at the time we were sort of short on time. And so that message went out to the executive committee saying, would we like to adopt this senior who needed a little help at the holiday time? And several individuals on the executive board came forth, and we got such things as blanket and snow boots and a few other things for this particular senior. And so the question has arisen, and I will pose it to the members. The question has arisen, would you be interested in continuing with this kind of project? Let's say once a quarter, for example, adopting a senior in one of our communities and providing some type of care package for that individual. So I'm going to put that out to the members and hear your point of view on that particular idea.
Sounds like a good idea to me.
Okay, Bill?
And
Someone
me as well. And I would be willing to volunteer to take on, doing some of these things, and whether it be quarterly or whatever we would decide to do to move forward with that.
Okay.
Would it be the same person all year or a different person per quarter?
Different person per quarter, I think we would be talking about.
Me, I think that's great. Carol Parks, I think it's great.
Think it's a good idea?
I
Okay.
love it.
If we did some of the collecting in advance, we might have enough things to do 2 people.
You never can tell, can you? Right.
This is Elaine. I vote yes.
Yes.
Okay, Elaine. I think the idea might have even come from you originally. Okay. Anybody else?
Me, I already voiced my support earlier on in this topic. I think it's a great idea, and I'm happy to help wherever you need me.
Yeah.
All right.
And I would help Marilyn.
Okay, wonderful.
Okay.
Couple of ones, but
Well, we'll look at the logistics, and see how I think it would not be this would be informal in the sense that I think we would be talking about contributions from members, like some kind of financial contribution. And then Marilyn has said she likes to shop, so she's
Haven't done much of that, in the past months, but yes, as a rule, I do like to shop. So,
Right. So, I mean, we would have to figure out
Yeah.
how to collect the donations, how to identify the individuals, how to distribute it, et cetera, et cetera. So there's some logistics that we can work on, but thank you for supporting the idea, and we'll give you an update next month on the details. So thanks a lot. I see we don't have any action items today. Are there any discussion items, some topic that you want to bring up?
B, this
Yes.
is Marilyn Massey.
Yes.
I just wanted to make a positive statement for UC Health. When I signed up on their online to get the vaccination, I thought that because the boilerplate said you had to put your insurance information, that was required, but it is not required because there is no charge for the shot. So I did learn while I was there that there is no need to worry about that. Just press continue and go on, which simplifies the online process immensely.
Right.
They're very efficient. You signed, you walk by up to the door, there's 6-foot deals. I was in and out in 30 minutes.
Mhm.
And that included a 15-minute wait time to make sure I didn't have a reaction. They provided snacks and water and very friendly, knowledgeable, efficient nurses to run the process. It's very impressive.
I found the same thing, Marilyn, at Centura Health.
Good.
Yeah, they're
One
very
thing.
efficient, very efficient, right?
One thing that I was impressed with, I assumed, I mean, I was given an appointment to come back. So when I made the initial appointment, the second appointment was part of the process. I'm hearing from friends in other states where they're unable to find an appointment to get the second shot. So Colorado's doing it right.
I think so. The same thing. I got my second appointment while I was that 15-minute wait. During the 15-minute wait, they made the second appointment. So.
Wow. When I went in, I got a email that said I should register with CU Health. I've never had any communication or contact with CU Health before, but because I wanted to be covered for an appointment, I went into it. And when I put in my email address, they said, you're already in the system. We have you just write your name. And I was curious where that came from because I've never had any contact with them.
I don't know. I was a new patient sign up since
Well,
they
that's
had
what that's what I thought I would be, but it said I was already there.
Yeah,
I have no idea.
Right.
Good news though.
Right. Any other comments, discussion items?
I
Yes.
just,
Go ahead, Bill.
when you don't show up for a meeting, you get elected to something.
Yes, well, that's true.
Everywhere.
That's great. Okay. How about calendar of events? Does anybody have any events on their, it seems like we have fewer events now that we're doing Zoom and so forth. Any other events out there?
There are a lot of events on Peak Radar. If
Okay.
anybody's interested in something to do that's a little entertaining.
I also noticed that UCC Center on Aging has quite a few different seminars, et cetera, that are available if anybody's interested.
Okay.
I'll just let everybody know that the Senior Resource Center has a Thursday night happy hour for all care providers in the senior community, and we welcome you all to attend that. It's a great opportunity to learn about all the different members we have as part of the Senior Resource Council. You get to collaborate with them, network with them, learn about some of their different types of work that they do. Tonight is Thursday as well, but instead of having happy hour, we have a marketing and admissions committee, which is a little more different, unless people talk a little bit about some of their processes that they have of it, getting seniors the kind of resources that they need. It's a great opportunity to learn about the people who work alongside with you in the community to make sure our seniors receive services. So you're all welcome to that. Please go to the seniorresourcecouncil.org and you can register right online there.
Okay, very good. Do you want to also put that in chat, just in case?
Sure
some
will.
people
Thank
want
you.
to See it written. Okay, well, our next meeting is the fourth Thursday, as usual, February 25th, 10 a.m. Once again via Zoom. And for our executive board members, we have our executive committee meetings on the first Tuesday of February at 10 a.m. And then, as Jen told us, the SRS committee is going to meet on February 11th at 10 a.m. So a few items on our agenda. Well, thanks so much for joining us today. Really appreciate both the members and our guests and our speakers. And seems that there's remains a lot of work to do for seniors in our area, and I appreciate all the contributions that all of you are making. So have a nice day.
Thank you very much, B.
You as well.
Thanks, B.
Thank you.
Thank you.
Bye
Bye-bye.
now.
Bye.